The happiest people do not have the best of everything, they make the best of everything. So, whatever the resources you have, you can make the best of everything which is with you. The diagnosis of osteoarthritis diagnosis is based on five parts. Number one, history and the physical examination. Number two, medical imaging, X-ray and MRI. Number three, other tests to rule out the other problems, and arthroscopy. Number four, and number five is the diagnostic biomarkers. First, the history and the physical examination, medical history, patient's health background, and the condition which are running in the family. Number next is crepitus, which is audible, palpable, crack, creaking, or the grating sound when the knee is flexed and extended during the examination. Then note the joint tenderness, reduced movement, and bony swelling or the prominence, particularly the finger joints, and one can see the habitants and the Boucher's nodes, excess fluid and malalignment that is measured by the goniometer. The next in diagnosis is medical imaging. X-ray confirmed diagnosis. Changes seen include joint space narrowing, subchondral sclerosis, that is increased bone formation around the joint. Then subchondral cysts are seen and osteophytes are also noted on X-ray. So that is the history taking and examination. And on X-ray, the things which have to be noted are one can see on X-ray the osteophytes, the bone cyst is there, and then bone sclerosis is also there, and the marginal osteophytes and the medial joint space is destruction. So the narrowing of the joint space as one can compare on this side. So it is on the medial side, the joint space is just lost. Now, continuing the medical imaging, X-ray to show how much the joint damage has done, and an MRI provides 2D view resulting in the better images of the joint and the surrounding tissue. If the X-ray results are not very clear, we do go for the MRI. It does not involve radiation risk, and it is useful to evaluate for the internal derangement of the knee and the early osteonecrosis. MRI also detect areas of the subchondral bone marrow edema responsible for the pain, and it can detect the meniscal tears also. So here one can see on MRI the structure which are much more clear than on the X-ray, and one can appreciate osteophytes and the cartilage loss as compared to the cartilage on the other side, which is normal. Then one can have the blood test to rule out the other problem with a similar presentation and symptoms, and one can go for the arthroscopy, and this is the arthroscopic instrument which is inserted into the joint, and one can view by the viewing scope the different structure damage which have been inside the joint, and one can also clear that debris which is there in the joint by this arthroscopy. Now, next in diagnosis is other test. There is no specific test for the osteoarthritis, but one have to rule out the other types of arthritis with the blood test like sedimentation rate, CRP, which are normal because it is not inflammatory disease, renal function test and the liver function test to have any loss in the renal function test or the liver function test. Synovial fluid exam is very important, as in the synovial fluid one can see the WBC which are much more as compared to the normal which are 200, and here in case of these are about 5000 WBCs, and percentage of the neutrophil is less than 25, as compared to normal, which is having no or the zero neutrophil. Appearance is clear yellow in osteoarthritis versus the transparent in the normal joint. The next in diagnosis is arthroscopy. Arthroscope is inserted into the joint area through small incision to find damage done to the joint. It have got high success rate due to the less damage done to the connective tissue. The next in diagnosis is diagnostic biomarkers. Biomarkers are the substances in the joint fluid, blood, or the urine of the patient that indicate changes in the bone or the cartilage of the involved joint. It detects degenerative arthritis or its risk factors much earlier than the X-ray or MRI finding. It will bring new options for averting the osteoarthritis. There are 37 different biomarkers of bone and the cartilage turnover. Urinary C-terminal telopeptide of the type 2 collagen UCTX2 as a prognostic marker for the knee and the hip osteoarthritis progression. And here one can see the indirect biomarkers of the joint, and there is tissue catabolism, the loss and the damage done in the joint to the synovial membrane, to the cartilage, to the bone, to the subchondral area of the bone, that can lead to the production of the direct biomarkers, and that direct biomarkers are responsible for the disease associated molecular proteins, and the disease pathway can be used to avert the changes in the osteoarthritis joint. The diagnostic biomarkers serum cartilage oligomeric matrix protein COMP levels as a prognostic marker for the incidence of both knee and hip osteoarthritis. Similarly, pro-collagen type 2 C-terminal propeptide P2CP levels reflect type 2 collagen synthesis in the body and within joint fluid, prognostic marker for the early osteoarthritis. One problem with this biomarker is that amount of the cartilage is reduced in case of osteoarthritis and the cartilage is worn away. So the patient have very advanced osteoarthritis, but not this biomarker detectable in the urine because of the worn away and the reduced cartilage. Now, coming to the differential diagnosis, which mimic like this, these are rheumatoid arthritis, but the joints here are not hot or red in case of osteoarthritis, which are red in case of rheumatoid arthritis. Gout, there is increased uric acid level in the blood, hemochromatosis due to the iron overload. On chronosis, there is calcification and ossification of the lumbar intervertebral discs, multiple epiphyseal and spondyloepiphyseal dysplasia, calcium pyrophosphate deposition disease like pseudogout, then acromegaly, there is increased growth hormone. So here one can see the red hot rheumatoid arthritis joint and the gout, there is big toe involvement and the increased uric acid level, hemochromatosis, increased iron level, and there is pain in the joints in case of hemochromatosis. Similarly, in case of onchronosis, there is narrowing of the disc space, and in case of the pseudogout, there is calcium deposition in the joint, and in case of acromegaly, there is a large size of the hand with a bigger hand, and that is also very prone to have the osteoarthritis. And continuing differential diagnosis, psoriatic arthritis, but there are skin lesions also positive, meniscal tear, osteonecrosis, neuropathic or Charcot joint, osteoarthritis due to trauma or mechanical factors, then trochanteric bursitis and enserine bursitis and dequervine tenosynovitis. There is a pain over the radial styloid and the base of the thumb that also give the similar presentation. So here one can see the psoriatic arthritis, but there are also the skin changes present here. In case of osteonecrosis of the femoral head, one can see the necrosis of the femoral head of the bone, from humeral head and the other bone which are involved because of the osteonecrosis. Then one can see the Charcot joint and there is a sore and there is a fracture of this bone which is giving the appearance of Charcot foot and that is visible on X-ray. Similarly, trochanteric bursitis. Here one can see the bursa or trochanteric bursa. If that is inflamed, that is also going to give you the pain like osteoarthritis. And here one can see the pes inserine bursitis. This pes inserine bursitis, there is pre-patellar bursa and there is pes inserine bursa which is here and that is going to cause the pain which is because of this pes inserine bursitis, the inflammation of the bursa. Similarly, dequervine tenosynovitis, as one can see, there is swollen tendon sheath and there is inflamed tendon which also give the pain like osteoarthritis. This is a picture, beautiful as taken by the photographer, that a person is just going to hold the sun in his hands and it's really imagination, beautiful imagination. Now, coming to the treatment of the osteoarthritis, it includes the many ways. These are lifestyle modification, physical therapy and exercise, sportive or assistive devices, then medication, intra-articular injections, then surgery, biological joint replacement, and the other alternative remedies are the part of the treatment. So the first is lifestyle modification, patient education for self-management of the arthritis. It decreases pain, improves the function, and reduces the stiffness and the fatigue. It decreases the joint stress by rest and the use of the cane. Weight loss for those who are overweight. The next step is physical therapy and exercise. Exercise is to strengthen the different muscles of the body, aerobic, weight bearing, isometric, aquatic, or resistant land based exercises are being used. Do swimming, walking, or bicycling. It improves the mobility and the increased strength of the muscle. Treadmill will, with minimal or no elevation, will also help. And moderate exercise, do 15 to 30 minutes 3 times per week is very useful. Massage therapy or the manual therapy have got no role. Now, the next in treatment is sportive or assistive devices. These are cane, crutches, or walkers, improve gait and the mobility and that diminish the pain. Place the cane in hand when using the cane. Place the cane in hand contralateral to the affected knee or the hip joint. And here one can see the physical therapy exercises which are being used to strengthen the muscle, as one can appreciate the different exercises which can be applied and used according to the need of the patient. Then sportive, these are the different kind of the exercises. Then sportive or assistive devices, these are the different kind of the sports, the cane, the crunches, and the different kind of the sticks which are useful for the different people according to their need. And one can use also the walker to walk with the assistance of this walker also. Now, when climbing the stairs in case of the sportive or assistive devices, climbing the stair, ascend each stair advancing with the good, the normal or unaffected limb first. But in contrast, when a person is descending each stair, advance the affected limb descends first ahead of the unaffected or the normal side. Finger splints or the knee braces or the lateral patellar tapping reduces the stress on the joint and ease pain. Use medially directed patellar tapping or wedge insoles in osteoarthritis of the spine, firmer mattress, and wearing a back brace or the neck collar will also be helpful. Now, the next in the treatment is medication. There are two types of the medication, oral and the topical. First, the oral medication. Paracetamol is the short-term first-line treatment and most of the time is recommended. For severe symptoms, non-steroidal anti-inflammatory drugs are effective, but consider its side effects like gastrointestinal bleeding, renal failure, high blood pressure, edema, and rash. Diclofenac sodium and naproxen sodium are the most effective non-steroidal anti-inflammatory drugs which are being used. There is a class of non-steroidal anti-inflammatory drugs which are called COX-2 selective inhibitors, and it includes celecoxib-like drugs. And these are COX-2 are equally effective with less gastrointestinal side effect, but these COX-2 inhibitors have high rates of the cardiovascular disease, and these are sometimes responsible for causing the myocardial infarction. Opioids, both weak like tramadol and stronger opioids, cause addiction, but these are very helpful to relieve the pain. Small benefits and large risk of side effects one have to consider. Oral steroids are not recommended. Tetracycline as cytokine inhibitors have disease modifying potential. So here one can see the paracetamol, the diclofenac sodium, the naproxen sodium, then COX-2 inhibitor, celecoxib, and that opioid derivative, the tramadol, and the tetracycline, which are the disease modifying agents. So the topical medication that is being used, these are available as creams, rubs, or sprays on skin of the affected area is applied. These are first line agent to avoid systemic therapy. These maximizes local delivery and minimizes systemic toxicity. Side effects are the local rash, itching, and burning, which is bearable as compared to the systemic effect of the oral medicine. Several non-steroidal anti-inflammatory drugs are available for the topical use, mostly diclofenac and ketotifen, etc. Morphine and fentanyl patches for the severe pain, but these interfere daily activities and sleep, so hinder the daily activity. The topical medication continuing, the topical capsaicin use is controversial. Capsaicin is the active ingredient of chili peppers. It modulates nociceptive fibers. Topical medication used daily for 2 weeks and avoid contact with eyes. Hydrotherapy, water therapy has been used in rheumatoid arthritis. Use of ice or cold packs is beneficial, but not hot packs on the joints, which is being used by the patient. So only use ice or the cold pack. Liniments, like methylcellulate, and that gives the temporary benefit. But basically, these are the counter irritant that divert your attention from the original pain to the new pain, which is the burning because of the application of these liniments and other like thing. So here is the diclofenac topical gel, and here is ketoprofen topical gel, and these are the fentanyl transdermal system. These are the morphine derivative patches, and that is capsaicin heat patch that is also sometime being used by the. Now the next in the treatment is intra-articular injections. These are glucocorticoid such as the hydrocortisone, which cause short-term pain relief, and there is increased bioavailability, less systemic exposure, and reduced adverse events as compared to the oral glucocorticoid. Ultrasound guided hip joint injection is given, and triamcinolone injection repeated use cause reduction in the cartilage thickness and the joint damage that is used in knees. Risk of the infection is there and causes the injury, crystals, increase in the intraocular pressure, which are the side effect of these glucocorticoid intra-articular injection. Now, there is one viscosupplementation for the osteoarthritis of the knee, positive effects on the post-injection that is being tried. One can imagine the tree which have been transformed by its hand on the child, which is giving the motherly picture, and I do label it as a motherly tree. It is really imagination of someone. Now, continuing the treatment, intra-articular injection of the hyaluronic acid have got no effect. Effectiveness of the injection of platelet-rich plasma is unclear. These improve function but not the pain. The next in the treatment is surgery. Several types of the surgery include joint replacement surgery or the resurfacing of the joint surface if ongoing disability and the conservative management is an ineffective. Damaged joint is replaced with an artificial joint for both knees and hips. So here one can see the intra-articular injection that is being given in the joint, and here again the intra-articular injection that is being. And here before one can see the knee joint that has been roughened, the cartilage lost, the space have gone, the meniscus has damaged, and after that one can see the resurfacing with the metal artificial joint, and that is just going to have a good mobility and no pain as it is in this case. And one can see on X-ray the joint functioning and the joint placement. Continuing the surgery, the shoulder replacement in shoulder osteoarthritis, shoulder hemiarthroplasty replacing part of the joint, total shoulder arthroplasty replacing the joint, also available to replace nowadays about fingers, elbows, ankles, and the back joints. An artificial metal joint lasts 10 to 15 years functioning. The other procedure in the surgery is bone fusion or arthrodesis. It is an option in ankle osteoarthritis. Ankle fusion is gold standard treatment in end stage cases of ankle osteoarthritis. Aim is to remove the damaged joint and fuse two bones on each side of the joint. So here one can see the joint replacement in case of the humerus, and that is the shoulder joint. That is the fusion arthrodesis, triple arthrodesis, it means the navicular bone, cuboid bone, and talus bone and calcaneus bone. Joints to be fused are marked in purple. So these joints between talus and calcaneus and cuboid that is fused. Similarly, the joint between talus and navicular is also fused, and the joint between calcaneus and the talus is also fused, and talus and cuboid is fused. So these are the fusion of the different joints in case of the ankle. Now, there is one more option, that is opening wedge, and there is the closing wedge. One can take the bone as opening wedge, and then we can use the plate by closing the wedge by putting the wedge inside. Now, continuing surgery, osteotomy done in the knee osteoarthritis, arthroscopy, as I have already told you, that it is to clean out damaged cartilage or to repair the tissue. It is done on the knee and the shoulder. Surgery cannot return the joint, all kind of the surgery cannot return the joint to its normal state as made by the God Almighty, but functional improvement is there and there is no pain. The next in the treatment is biological joint replacement. This is a new treatment replacing the diseased tissue with the new ones. It is from a person, that is called autograft, or from a donor, which is allograft. This joint transplant, which is called osteochondral allograft, do not need immunosuppressants because as bone and the cartilage tissue have limited immune responses. Autologous articular cartilage transfer from a non-weight bearing area of the same person to the damaged area is called autologous articular cartilage transfer. It is called osteochondral autograft transfer also. When missing cartilage is a focal defect, autologous chondrocyte implantation is another option. In the treatment, the other alternate remedies are glucosamine and chondroitin. Effect of the glucosamine is controversial, and here one can see the biological joint replacement at the meniscus and the other part of the joint which has been lost, that is being replaced as compared to the total joint replacement. And here also one can see the knee joint, and there is patella construct, and that is going to repair the patella, and that is the part of a biological joint replacement. Then these are the glucosamine sulfate and glucosamine with chondroitin sulfate, but their role is not very much clear. Glucosamine sulfate is better than glucosamine hydrochloride. Glucosamine sulfate and chondroitin sulfate is useful for the knee osteoarthritis. Then avocado, soybean, unsaponifiable ASU is an extract made from avocado oil and soybean oil. It also helps to relieve the pain. Boswellia serrata show consistent but small improvement in pain and function. Hydroxychloroquine HCQ used in the rheumatoid arthritis, and the colchicine in gout is not beneficial in pain relief in case of osteoarthritis. The other alternative remedies are limited beneficial evidence of hyaluronan, methyl sulfonyl methane, MSM, rosehip or the vitamin D. Oral collagen supplementation reduces stiffness but no pain improvement. Curcumin, phytodollar, and S. Adenosyl methionine, same, may improve pain. Disease modifying osteoarthritis drugs, DMOAD, like strontium ranitidine, has some role because it decreased degeneration in osteoarthritis and improve the outcome. Then gene therapy transfer mean gene transfer strategies to target the disease process, not the symptom. So here one can see the collagen peptide and strontium capsule which are being used. In gene augmentation therapy, a gene which is being put in the cells which are not having that gene. So these are disease cells, they lack a gene A product that is being inserted in these cells. So the new cells are normal phenotype that have got increase in gene A product, and one can see the gene A which has been inserted in these disease cell. Then acupuncture, that is having some role in some places, and one can see the point where the needles are being inserted, and that is going to give the relief in case of acupuncture. Continuing the other alternative remedies, acupuncture provide significant and immediate pain relief in some people. Then electrostimulation technique like TENS, not able to reduce pain or the disability. Low level laser therapy give short term pain relief for the osteoarthritic knees. Balneotherapy for osteoarthritis, mineral bath or SPA treatments improve quality of the life or the ability to function. Therapeutic ultrasound may be beneficial for osteoarthritis of knee, but still its role is controversial. Phonopharesis is not very beneficial, as one can see the TENS unit that is being applied on the knee, and two, the pad is placed for the pain relief of the knee. Similarly, one can see the laser therapy, the laser beam is being put on the knee to relieve the pain, and balneotherapy, that is the area of the certain oceans which contain certain minerals, and the people are taking bath in that and they feel relief after having this process is called balneotherapy. Then ultrasound therapy, as one can see, the ultrasound waves are being put on the joint, and it is just going to have the relief of the pain. Phonophoresis. Here there is applied formulation of certain medicine on the skin, as one can see, and by the ultrasound transducer and by electric supply, it is going to push that medicine into the skin and giving the relief to the pain on of the area of that joint through the skin permeation of this formulation of the medicine. Then there is pulse electromagnetic field therapy that is also going to have some benefit in certain cases. The continuous and pulsed ultrasound modes, 15 minutes per session, 3 sessions per week for 8 weeks is beneficial. It improves patient physical function and the pain. Weak evidence of electromagnetic field for the moderate pain relief, as I have shown you. None of these treatments reverse or slow progression of the joint damage caused by the osteoarthritis. The type of the treatment will depend on the age, activities, occupation, and overall health of the patient, medical history, location of the osteoarthritis, and the severity of the condition. Now, the last is how to prevent osteoarthritis. Number one is the weight control. Number two is the injury prevention. Number three, doing some exercise and the diet, which is having enough vitamins like vitamin C, vitamin D, and calcium. So that is the end of the osteoarthritis lecture. I have given as much as possible about this subject, and I hope If you like so, please prescribe, subscribe my channel and share my lecture to the other so that the other people can also benefit from that. For any question, you will contact me. And thank you very much to be with me and the patience listening.